right, welcome to the Herbal Hour. Today we have a great guest here. His name is Clayton Leaders. He has a master's in public health, and he's starting a nonprofit in public health. I want to start this off by just asking you a critical question. What do you think is wrong with healthcare today?
Well, personally, I think that healthcare should just be a right, and I think that despite what your socioeconomic status is, you need healthcare. And I think that the powers that be right now just don't seem to care about that, and that's an issue.
That's so true. The lowest among us get forgotten, like people without insurance. That's a constant problem in these clinics.
Exactly.
Because a lot of medical care costs a lot of money. All this imaging, it's expensive, especially if you don't have insurance.
Right.
Why do you think the powers that be do not care?
Well, I mean, mostly because they're wealthy, and they don't have the worries that like a lot of other, communities.
They
like
can't
populations
relate
have.
to
Exactly
the general populace to some degree.
And I think especially in political terms, it just comes down to they don't see that those communities and populations that are in the place that they are without healthcare. They don't understand what that feels like personally.
Right, because they've never experienced it.
Right.
So today we're focusing on topics in public health and issues in the healthcare system. This episode is called Medicine for the People. And what we're going to dive into is what is the ideal healthcare system that can really serve the people and not just serve the insurance companies and the hospitals and the CEOs. Obviously, they're allowed to make money, but at its core, healthcare is always about service. And if it becomes too much run like a business where profit motive is the main concern, you kind of lose out on the actual healthcare aspect of it because there is so much care in healthcare that you can't take out.
I like that. Good point.
Yeah. So what is public health and global health?
Well, first off, I just want to thank you for having me on.
Yeah.
Good friend of mine, colleague. Public health, global health. I mean, think of, anything you ever see from the World Health Organization, the CDC, Center for Disease Control. It's a lot of just studying statistics and patterns in not even necessarily just within healthcare clinics and hospitals, but just sort of trends in communities and populations, and trying to take what you can from those studies and applying it to then develop community outreach, mostly through community education, and just various things there was this is funny, there was a thing a few years ago that used a zombie apocalypse as a way to educate on emergency preparedness, and just things like that. They just study these things that people don't really understand in communities, and then they just find ways to reach out and make just essentially it all comes down to education and prevention. Yeah.
What do you think is the biggest limitation for why these policies can't be applied on a wide scale? We know a lot of things from research that, smoking cigarettes is bad for your health. We know that lifestyle, diet, exercise have big impact on chronic diseases like diabetes and heart disease. And we know all these things, and the research is 100% on it. But still, on a wide scale, hospitals are serving sugary Jell-O to people recovering from surgery. Clinics have candy that they're handing out to people. And all these little examples.
Lollipops at the dentist.
Exactly, at the dentist.
Right.
That's a particularly bad one.
I know.
Well, it keeps their job going though. So it's yeah.
Ooh.
Got to keep your
No,
patience.
I have a good answer to that. One of the factors of public health is behavior change and just behavior change theory, which is an entire podcast within itself.
Absolutely, yeah.
But I think what that really comes down to is why these things sustain themselves, smoking, diet and exercise leading to diabetes and cardiovascular disease. I think it just all comes down to we're not approaching it in a way that like actually helps people make those behavior changes.
Right.
And I think we could. Mm-hmm. And I think the idea that like the CDC has of just like throwing out ideas like, hey, 40% of smokers get lung cancer. I mean, that's a totally wrong statistic. Like, I'm not. Don't take me on that. But that doesn't help change.
People actually stop
behaviors.
smoking,
right?
Because everyone knows that it's bad for your health.
Right.
It's not a question of even education in that case.
Right. It's like, I mean, and gosh, I mean, I'm sure both of us have tried to change health behaviors.
Absolutely,
and like it can be very, very hard.
They're incredibly difficult to change.
It really is.
And most recommendations are not helpful. I was talking to Dr. Chandler about lifestyle change quite a bit, and we were discussing that at like the doctor's office, conventional doc, an MD, they widely understand that diet and lifestyle are important factors of health, but they don't really give due time for a lot of reasons. They might not have enough time. That might not be their focus. So they'll say something like, oh, like Mr. Johnson, like you need to stop smoking, or like Mr. Johnson, stop eating donuts, like you have diabetes.
Right.
And Mr. Johnson's like, okay, and then he comes back. He's like, oh, Mr. Johnson, how are you doing? Yeah, I'm still smoking and eating donuts.
Right.
That's like the most typical case ever.
Yeah, I mean, I think that's a huge failing of the medical system. I mean, you've probably talked a bit about this on this podcast, but just like that we don't put the time into like actually assisting people in their health process. And I think that's another, like, that's a sort of like one-on-one sort of patient-doctor thing. But I think that the public health system, at least in America, I'm not well educated enough to say about other places, but at least in America, I think that we could do a much better job about like assisting the public in behavior change.
Absolutely. So we were talking before a little bit about the difference between global health and public health. Is there a difference? And what kind of inspired you to pursue education in global health? Like, did you travel a lot? Did it kind of open your eyes to the possibility that there's something outside the United States that is worth caring about?
Yeah. I mean, public health and global health have a lot in common. I would say that initially. I think what sort of separated public health from global health for me was that public health has a lot of like ideas that have like a sort of colonial concept, and global
like this
health,
is the right way, and we know best, and this is the best for your health.
Right. And global health, even though it has so many of the same like practices and modalities and just like, concepts, it more takes into account, and this applies both abroad and here, like whatever community you go into, population, whatever, that like partnership with the community is incredibly important. Like you can't really affect a change in a population without
being part of the community,
partnering with them.
Interesting. So, what are some ways that that doctors or people who work in health or people who are just kind of donating their help to a volunteer service, what are ways that they can become more ingrained in the community that they want to help?
I mean, I think if you go into a community and just like assert like your ideas and just like stand back and like see who comes forward to who's looking to be empowered and who's looking for education, who's looking to like help their friends and family there. If you just like look for the people, I mean, Fred Rogers, Mr. Rogers with the cardigan, one of his most famous quotes is "Look for the helpers." And I think that is absolutely one of the most essential parts of global health, is like going into a community, not pretending like you're the savior, but looking into the community and looking for the people who are looking to help. Look for the helpers.
That makes a lot of sense.
Yeah.
Because it seems that change cannot be made alone in almost every case. And I think that's something that certain political leaders might not realize, that you need a lot of people to make any kind of lasting change in any field, whether that's politics or healthcare, religion.
Yeah, I mean, and especially in healthcare work in communities that you aren't from, because like I can't understand what a community needs if I'm not part of that community. So to have those people step forward is essential to understand. And maybe I won't ever understand, but to have them understand and then empower them to effect a change, I think is
There's a story that's very illustrative of the wrong way to go about public health. So there was a certain indigenous tribe in Africa, and people came there to give relief, kind of give them supplies, food supplies. Do you know the story?
I think so.
One of the things that they gave these women who were at the time with child, or they were breastfeeding, is like powdered product, like lactation formulas, that kind of thing, to like replacements for breast milk. And it was all done in a good intention. It was meant to help, they're impoverished. They might not have that much food, so breastfeeding might be a little bit more difficult for them. But what they found, so they kind of gave all these supplies and then they just left.
Right.
Then they come back, and the women who are breastfeeding can no longer breastfeed anymore. They become too reliant on these formulas, and now they can't even do their natural milk production because they kind of like weaned the baby off and haven't been using it, and now they're in demand for this formula.
Wow.
So our help was actually not help at all. Like it completely ruined their community, essentially.
There's so many stories like that. Like there's another one, I think, I forget where the community was. I want to say South America somewhere, but basically what it comes down to is that like Americans went in, and the standard American diet.
Right.
Terrible.
Excuse me, it's terrible.
We for some reason saw this community that was in sort of like a food desert sort of situation, even though they were, indigenous to their area, native. One of their main things that they ate was like apricot pits. They actually, they're supposedly poisonous. Like I don't think it was like a staple to their diet, but like they were kind of relying on that as one of their things.
Interesting.
We went down and gave them all this. They had never had a case of cancer in their entire history. They didn't know what cancer was. We went down, gave them, all this food, a direct line for supplies, and within 5 years, they had the first cancer deaths of their entire history.
Wow.
And I mean, that's just one example.
This reminds me a lot of the spreading of religion, like early Christianity, and kind of moving it through the land as, this is the truth and people should submit to it, rather than seeing that the cultures that were there already had very developed religious systems. They were, in general, more shamanically based. They were more based around nature worship, worshiping animals, living off the lands. Beliefs that actually really help someone live in harmony with nature, not like Christianity, which early on was very strong on saying the body is evil, the body is the place of all sin, and it needs to be destroyed. There was certain very fundamentalist Christians in the beginning.
Well, that's negotiable, but I get what you're saying. I mean, there are tie-ins to those ideas. Yeah,
absolutely. So you consider yourself a Christian, right? I know we've spoken about this.
I do, yeah.
But you have a little bit of a different view than is typical, I would say, at least from what I understood. A little bit more of a mystical view, I would call it. So how does your religious life play into your healing practice?
Well, I mean, yeah, I consider myself a Christian. I believe, in God, and there's divine sort of interconnection in nature and stuff like that. And I think that that's one of the things that also attracted me to naturopathic medicine was I think that if a creator made all this stuff, then there's a reason for it to be here. And herbs are a great example. It's all here for us to use and be healed by. And maybe that's a little bit different from what other people perceive and understand about religion or Christianity, or how to approach the world through that Christian Jesus-oriented lens. But that's sort of what I see. And I also just sort of see a lot of my ideas of what my purpose is through healing comes through a belief that, that I'm just like trying to like focus the energies that Jesus like played out in his life into the current day.
Well, he was a healer, right? He was a healer of people.
Totally.
Just as much as he was a religious leader, he also was going around and healing the sick.
Right.
So there's this idea very early on that healing is a spiritual practice, at its core. Early on, hospitals and things of that nature were always free because they were always donation-based services.
Yeah.
Now it's become a very business type of situation where it's all about, the bottom line.
Because like if you look back at medieval medicine, it was basically all like monasteries and like nuns and all this sort of stuff. Yeah.
Exactly. And they're actually the earliest scientists, interestingly, were monks.
Yeah.
Because they had a lot of time at the monasteries to themselves. And they had a lot of plants growing in their gardens, and they kind of just became interested in how can we do something with this?
And that even extended into like astrology and stuff like that. Monks and stuff.
That's very fascinating.
Yeah. Yeah.
Yeah, there's a saying in the Bible that I think of pretty often. I believe it's in Genesis, in some portion of it, where it says something along the lines of, and so God created trees so that the leaves would be the healing of people and the fruits were made to be eaten by people. This idea that, an ancient idea, in fact, that for every illness, there's a cure found in nature. Because illness and health are fundamentally linked to some kind of almost divine plan, that it's not accidental that someone gets sick, but it's meant to be a lesson in their lives. I've heard that very often, especially with terminal patients. On last episode, I talked about this story of this man who was diagnosed with terminal cancer. And he basically went off to this island to die. He was there to visit his family and help out, but, he was like tending the gardens, he was growing things, and he ended up living for another 20 years. Right? So he had terminal lung cancer, stage 4. Whoa. And the thing that blew my mind, what Dr. Chandler said, is that he ended up outliving most of his doctors who gave him the terminal diagnosis. Whoa. Why? Because he went off to some island and basically was cured inadvertently.
Improved his life overall.
Right. So there's kind of this meaning aspect that I think is missing in a lot of medicine. And it's a big focus in my practice. My plans are to be very focused around mental health and kind of what would be called naturopathic psychiatry, although that isn't a legal term because psychiatry is something that an MD practices, but basically like natural mental health.
Yeah.
And I think one of the big components that really is not addressed enough when it comes to healing, does the person have meaning in their life? Do they find that their interactions with people are meaningful? Do they have love for their family? Do they feel like their work makes an impact? Do they do fun things? Do they have passion in their life? Because without that, what's the point of being healthy? You have nothing to live for. Like if you hate your life, why would you want to get better? There's no reason to.
That's interesting because there's a lot of research on that.
Really?
That shows that people who are in just better places emotionally and like spiritually and relationally, have better outcomes. But it's funny to think about, like, is that the chicken or the egg? Are they like that because they're healthier, or are they healthier because they're like that?
I think it's both. It's probably some kind of like hard to separate, like they feed into each other kind of. Their nature is like that, so when they do that, that makes them better.
True.
But also because they do that, it makes them do it and be better.
But I feel like that's kind of limiting to people who aren't in that place. I don't know. Do you know what I'm saying?
Yeah, absolutely. So what are your favorite herbs to use? Oh. This is the Herbal Hour.
We should talk about herbs.
Yes, herbs are obviously one of my main passions.
Yes.
And I love to talk about them. So let's say 5 herbs that you can bring with you to a deserted island. Which ones would they be? What's in your herb pouch?
Are we extending herbs to like fish oil and stuff like that, or are we strictly speaking herbs?
Let's open that up to all like supplements and natural supplements. Yeah.
Okay.
Would you bring fish oil?
I would.
There's some good research behind that.
I find, I mean, I try to follow the Mediterranean diet, and there's so much research into omega-3s and just like fantastic stuff. But anyway, getting back to your question.
So we got fish oil.
Fish oil. Ashwagandha is one of my favorites. I think that Withania somnifera.
Yeah, that's right. That's the name.
I think it translates to like strength of the horse, I believe. That's just one of my favorites. It was one of the first ones that I took not as a treatment, but just as a supplement that I could actually feel like within an afternoon. I was like, oh my gosh, this is fantastic. Butterbur, I would say. I used to get really bad headaches. Butterbur has a affinity for the cardiovascular system. And so like when I get a headache, it's kind of the only thing that helps. So I definitely take that.
Yeah, Butterbur has some pretty good research being used for migraines. So does Feverfew. Typically, they're actually used together for migraines, along with some other things. Okay. I love those herbs.
Yeah, Feverfew is another one that I like, but I've never like used it a whole lot.
Right.
Turmeric, again, just because there's so much research into it, and like if you look into populations, say like in Pakistan and India and places like that just use so much of it. A lot of research shows that it reduces, just that those communities don't have the same kinds of diseases that we have, like diabetes and things like that. So I'm at 4 now, right?
Yeah, you got one more.
Oh, man. Well...
What's your go-to herb for like if you get sick or something? Because what if you get sick on the island?
Well, I mean, if I get sick, I go to zinc.
Zinc?
I mean, I like zinc a whole lot.
Zinc has some great stuff, especially in combination with vitamin C.
Yeah.
Good list.
Yeah, I was thinking vitamin C, but I thought I'd go with zinc, because especially zinc is really also very impactful for just overall men's health.
Yeah, right, because it's necessary in the production of, I believe, sperm cells and hormones.
Sperm and just all sorts of other things.
Right,
yeah,
it's like a necessary cofactor there.
Yeah, it does a lot for men's health.
Yeah.
So, I don't know, yeah, let's say those 5.
I like those 5.
Yeah.
Okay, these are the 5 that I would bring.
Okay.
So, the first one definitely would be Camellia sinensis.
Okay.
AKA tea. The original tea, the caffeinated black tea, green tea. I'm not going to make any distinction because it's typically the same species. So I would definitely have that. I feel that on an island I would need that. Energy, it's good, it's vitalizing. There's some great research with green tea being used for all sorts of stuff. So it's got some surprising health benefits too.
Cancer prevention.
Yeah, absolutely. My number 2 herb would actually be a mushroom.
Ooh, I forgot about mushrooms.
Yes. Psilocybin. I would bring psilocybin with me 100%, especially if I was alone. I can imagine that living on an island alone would be very difficult mentally on my psyche. And I think that some kind of entheogenic or psychedelic plants could do wonders in having me maintain peace and a meaningful life on my own. It would be difficult without some kind of mind-altering herb. I mean, can you imagine being completely 100% clear-minded and sober on an island that you live on alone? Like, yeah, it's helpful, but you would get tired of it really quickly, and you'd be like, this is terrible. Like, what do I even do with my life now? I can't talk to anybody.
Right, and with psilocybin especially, there's some incredible research. Michael Pollan wrote a book on psychedelics.
How to Change Your Mind.
Yeah, fantastic book. But like, there's so much research on the effects that has for your... Oh my goodness, there's just so much to it.
What are like the big things that he talked about in the book? Like, what's the purpose of psilocybin?
The main thing is like addiction relief. I don't know how to say that. Recovery, yeah. Whether like from alcohol, smoking, other drugs, just like whatever. It allows your mind to sort of like just readjust. It's like just trains your mind to just be like within, I think one of the studies showed that after one psilocybin trip, with counseling along the way, within one thing, a person who was smoking 2 packs a day would go to smoking nothing and not even feel like withdrawal. That was the main thing I took away from it. He talks about a lot of more like little obscure things, just like religious or like spiritual experiences that like people claim, they saw angels or something like that. I mean, that's sort of not necessarily health focused in my opinion.
Interesting.
Yeah, I don't know.
Yeah, I would say that spirituality, at least in my view of health, is an integral part. Because to me, spirituality means what is that person's perspective on what the meaning of life is. And that is incredibly important to help them actually make lifestyle changes. Because if someone's completely nihilistic and they think there's no point to life, there's no meaning, in a very negative sense, why would they want to exercise? Why would they want to do anything? Why would they want to help people or be of service in anything other than a purely selfish way? So it gives a lot of motivation.
I agree with that. I think more what I mean is like, it's not a direct like treatment.
Oh.
And like seeing angels could be an idea of just like psychedelic experience.
Right. Okay, I see your
be
point.
Like seeing angels.
Oh,
like,
I get your
okay,
point.
yeah,
Okay.
Yeah.
What if the angel tells you though how to cure yourself, and the angel is just a deep part of your psyche,
like you're
speaking to yourself? That's kind of how I view angels and guardian angels. Okay. I view them as what would be called in the spiritual communities the highest self. That it's really some aspect of you, maybe the most divine, enlightened version of you that kind of resides within you, and sort every once in a while says like, "Don't do this," or like, "Do that," like do that, like intuition kind of. So subconscious, yeah, meaning unconscious, that we're not aware of it all the time.
Yeah, I get that.
My other three. All right, so we got green tea. We got psilocybin. We're already having a good time on this island. What else? I would say St. John's wort. One of my favorite all-time plants. I've worked with it extensively. I love the energy of this plant. It has so much research, it being used for depression, anxiety, that would be so crucial to have on islands. And also, as a side benefit, it is very good for wounds and very good for wound care. The oil and the juice is very antiseptic, very antibacterial, and it could be used for wound healing and nerve damage. So like it's kind of like a twofer. It's a 2-in-1. That herb would help my mind, and it would also help like if I got injured.
You're approaching this differently than I approached my 5.
Yeah, I'm like really trying to think like if I'm actually going to go on the islands, like what would I actually? So my other 2, I would probably bring garlic. Because it's such a good antibacterial and antibiotic.
Yeah.
And that could be amazing, like a poultice on a wound, or like that. I mean, that sounds so terribly painful. But I mean, it would kill all things there, including cells. And then eating it in my experience, is one of the most powerful, like, you know how like a lot of times like elderberry is used and echinacea for like illness. But what I found is that when I start getting sick, if I feel like a sore throat coming on, it means 2 things for me. One, I go complete fasting, complete water fast, and I lay down. I stop moving, and then the main medicinal treatment is just chewing raw garlic. It's incredibly painful, but I've had experiences where I felt like a sore throat coming on, and I was like, I would just go do my routine, drink some like hot tea, maybe some ginger with some lemon, honey. I would stop eating. I wouldn't even be hungry, so I don't understand why people ever eat while they're sick if they're not hungry. And then I would just start chewing cloves and cloves, like maybe 10. What? Sometimes I mash it up and mix it in with honey and I eat it. That makes it a lot more palatable. Yeah. Sometimes I mash it up and put it in like a little bit of food, like some very small portion of like lentils or something.
Wow.
And that helps it go down. But I like actually, especially for sore throats, for myself, that it actually makes contact with my throat and burns there. That's how I know it's actually killing all the bacteria there. And I've had experiences where a sore throat did not become a sore throat. Like it just started becoming a sore throat, and then I was just like, garlic. And by the next day, I was like completely fine.
Really?
I've had more than one experience with that. So garlic is 100% something I'm going to be bringing with me. Okay. Also, it's amazing for flavoring.
Well,
and cooking. I mean, can you beat
you
like
catch those fish?
get some avocado, squeeze the oil out, and
Yeah.
maybe if you have like I don't know if you would have a pan, but you'd figure out how to saute some garlic. So definitely that. And then the last one, I would probably bring.
The last one is the hardest.
It is, because this is it for what I have. What would I need on an island? I might.
Like cordyceps or something?
I would bring ginseng.
Okay.
I mean, it's also incredibly expensive, so it's a good thing to have in bulk, let's say, like for some reason. So Panax ginseng, Asian ginseng.
Yeah.
Just great adaptogen, energy, recovery, just good like thing to just take, kind of like ashwagandha, just to take it all the time as like a tonic. I think that would be necessary for all the physical activity I'd be doing. So I'd be pretty happy with those 5. I think I would be pretty damn healthy actually on just those 5, and I'd be very mentally well too.
That sounds good.
Yeah,
like
that's
it.
cool.
Yeah, that was a good little exercise.
Right,
like,
yeah.
Racking our brains about
It's
herbs.
totally impromptu.
Yeah, no, definitely.
But yeah, I think that's the way I like to think about herbs is like what place do they have in my life? Not like, the research says that it's good for this, but like what is the benefit that I actually noticed? Because I don't know if you found this, but I found that the more I work with specific herbs, the more I kind of get like a feeling for how they affect me. Totally. Almost in like an energetic way. Like when I think about like St. John's wort, like I can like feel it, and I can feel like the color of it or something. It's hard to explain. Like I can feel exactly how it affects me in a very gestalt, like non-specific way. Like I know that if I start taking a big dose of St. John's wort, like I know how I'm going to feel because I felt it before.
So you feel it when you think about it?
Yeah. Like I get a kind of like reminiscence of what the feeling is. Like it makes me feel actually kind of good and like cheerful.
That almost makes it seem like you don't need to take it anymore.
That's a theory. That's a theory for like the plant spirit aspects.
Yeah.
I don't know if you believe in plant spirits, but a lot of indigenous cultures have that belief, and it does seem to have some merit to it.
I mean, like I said, I believe that a creator made all of this stuff, so I think that a spirit is totally within things like that.
Right. So. And then like valerian, like I know exactly what valerian feels like. Yeah. It's like this kind of it makes you kind of like a little bit drowsy, like very calm and sedate, and then it's like a little bit like warm. You feel like a little bit of like a warmth.
Yeah, that's
right?
Totally true.
And that's exactly what the traditional herbalists say. That it's warming, that it's sedating, it's calming, helps with sleep, etc. But the way I approach it, and I've done in a few of the different herb workshops that I told you about that I hosted, which were basically showing people how to make tinctures or liquid herbal extracts. In the beginning of them, I would have like a meditation where we would, try like a little bit of an herbal extract, and then we would, meditate and try to be aware of how we felt and kind of share our experience before we even started talking about, what did the herb books say about the effect of this. And surprisingly, the experiences were very in line with what they said.
Interesting.
Like we used like a cinnamon tincture. It was cinnamon and ginger made from dried. It was such a hot tincture. It was meant to illustrate the heat principle in herbs. We took it and like instantly you would just feel like warm, kind of like almost like start sweating, and secretions would start going, like your nose would get runny. You'd start like kind of like feeling your stomach gurgling and all this. And then we looked into the book after, like straight out the book, and it's like, yeah, it's a digestive stimulant. Yeah, it's an expectorant, meaning it like thins mucus. Yeah, it's a circulatory stimulant, means it would make you warm. And it's like,
wow, that's cool.
That's the way I approach herbs these days, and it's an incredibly difficult and long way to do it, but I feel like it's the only sure information because there's like a million theories about herbs.
That is very interesting.
Yeah.
So
what have been some of your pivotal experiences that you've had with herbs? I know you were telling a little bit about butterbur and how you had pretty bad headaches. You took that for a while and it seemed to help you.
Well, I mean, that was just like, I think that's the most pivotal. That's like even almost what turned my mind onto the idea that there's actually something to herbal medicine. Because growing up, I didn't have any like firm beliefs in any sort of medicine. It was just like do what the doctor says, like take the antibiotics, try ibuprofen, Tylenol, whatever. But I just had these headaches. I talked to a doctor at our school, and he said that if he was my doctor at that time, he would have diagnosed me with cluster headaches, which is one of the worst kind of headaches. Just incredibly
Those are the
painful.
kind of ones where your eyes are like leaking and all
Yeah,
that
it was
stuff,
always
right?
on like one, like the right eye, like behind the right eye, just really classic cluster headache.
Interesting.
Incredibly painful. I would just like roll around in bed in pain. And I took, Tylenol, ibuprofen,
Didn't help.
all sorts of doses of those two together or separate. And nothing helped. And then actually my mom did some research and found butterbur as a headache remedy. And I was just like, whatever, I'll like try anything. And I took 2 caps, which I don't know what the dosage is exactly.
It must have been
Might
an
be,
extract, I'm assuming.
It was just powdered, yeah.
So that's a pretty small dose of it.
Yeah, definitely a small dose. And I took it when I felt the headache coming on, and within 30 minutes it was gone, literally. And I had never experienced anything like that. I mean, that's the most profound experience I've ever had with NURB. Just incredible.
That's amazing.
Yeah.
That's one of the things that I really love about herbalism, and why, out of all the modalities of us being naturopathic students, in a year or two, we're going to be naturopathic physicians. And we have a lot of modalities, meaning a lot of ways that we go about healing. Some people really like water therapies. Some people really like homeopathy. Some people really like lifestyle change, diet, exercise. Some people are really into herbs. Some people are more into vitamins and nutrients. One of the reasons why I find herbs particularly not only fascinating, but they resonate with me, is because of what you said with direct experiences with a plant. So if I feel nausea or something, 9 times out of 10, if I start chewing on some raw ginger, it completely goes away. I don't even think they have a pharmaceutical that can do that quickly for me, because literally I'll bite it, I'll chew it, I'll feel my mouth watering, and I'll feel my stomach gurgling, and I'll burp 1 or 2 times, and then in 5 minutes I have no nausea, no tummy ache whatsoever.
No, the only thing that pharmacy has like that is an emetic, which makes you throw up immediately.
Yeah. Well, I mean, that would make your nausea feel better if you threw up.
True.
But that's probably not the way that I would go about it.
Right, exactly. That's my point. It's just nothing works that fast in the pharmaceutical world, it seems like.
Another reason, and I think you could speak to this too from a global health perspective. So firstly, it's key to note that much of the world still uses herbs extensively for healing. It's only here in this country that we think of herbs as being something different than medicine. Most countries, they're very tied into not only the medical systems, but the folk traditions are still very alive and well. What do you think the role of herbalism is in global health, being that it's still being used by so many people? And I mean, it's cheap to make, it grows itself. What kind of third world country can have a factory to make pharmaceuticals anyway?
Absolutely. That's a very good point. That was one of that I wanted to bring up, actually. Again, you're bringing up all this stuff for reasons why I got into naturopathic medicine. And because, there's so much I could talk about. But especially with that, I've been around the world a little bit, and I've seen how, like you said, how there's just not the resources for pharmaceuticals a lot of the time, and the people are so still retaining those traditional remedies, and they're very impactful, and they totally believe in them. So to be able to go to those places and learn from them, and also in places where they're starting to lose that those ideas of their traditional roots.
Yeah. Institute.
Yeah. You can try to assist them, but I think that's a huge factor of why naturopathic medicine ties into global health and the communities.
Because that is the medicine of the world still, as much as
and
modern medicine has progressed. It's still not everywhere in the world.
And it's interesting if you can look at places like Nepal, or Kathmandu is in Nepal, but all these places India, Pakistan, anywhere in Africa you go, South America, Brazil, a lot of places, you can look at those places and see they're still using this stuff. But then here in America, we assume that the entire country is just pharmaceutical based, right, and surgery based. But you can still find, especially native populations, in like the Colorado Plateau, or if you go up to Alaska or even into Canada, they're still really like into their traditional healing practices.
It makes sense. I mean, I was thinking about this. If, God forbid, any kind of catastrophe happens and like we go off the electrical grid and like society more or less, like civilization falls apart, like how are you going to make pharmaceutical pills? Like that's the end of it.
And like you
and
said,
then you have to know how to survive in the forest. You have to know which herb you eat to not die from dysentery.
And just to be able to grow your medicine. You can do that anywhere. Doesn't matter where you go.
It's very empowering to be able to grow your own healing medicine.
Yeah. I mean, it might vary what kind of medicine you grow based on, environmental things and such. But if you have an education that equips you to have the understanding of like what can grow, what it can do in your place, that's huge. And I think that's another reason why I think that naturopathic medicine is such a good way to just like empower communities to heal themselves, I don't know if that's the right way to put it, but yeah.
I think so too. I mean, using the medicines that people are comfortable with in their area, I think that goes along with exactly what you said about not, coming with a ready-made idea and pushing it on people, but looking through their healthcare systems and seeing what are they doing that's good. Like, let's help them with that.
Precisely.
Instead of trying to be like, no, like you take antibiotics when you're sick, not garlic.
Yeah.
Even if the effect is the same.
And potentially even like through getting to know the community and the area and stuff like that. And this, again, goes for both like domestic and abroad. If those communities are forgetting their traditional, like, medicines, if you do the research, you can find that stuff and then like remind them that they don't have to rely on, the doctor who comes in once every 6 months.
Right.
Which I think is a terrible practice as far as like public health and global health goes.
Absolutely.
Yeah.
So let's say that you got a letter in the mail and the letter in the mail said, Clayton Leaders, we want you to be the Prime Minister of Health in this country. What do you do on your first year in office? Another fun little thought experiment I just thought of.
In this country?
In this country.
In
yes.
America?
Yeah, in America.
Wow.
What would you do? I mean, let's say you have like totalitarian dictatorial power to change the healthcare system. What would you do?
That is a very good question. I think first off, I would like overhaul the insurance system. Because I don't think you look at a lot of doctors and you think that like they're bad doctors, but it's not that they're bad doctors. It's that they're run by a really corrupt insurance system.
Absolutely.
And I think that would be like the first thing I would do. And
there's actually there's people within these insurance companies that their paid job is to do one thing. It's to find reasons why certain people's health claims are not legitimate and find ways to not pay them. So there's actually someone actively looking for loopholes for why they shouldn't pay for your health care.
Totally, yeah.
What is that?
That's the penultimate example of corruption.
Yeah, and it's not illegal. Ugh. It's not even illegal. Like, even though it's completely immoral,
yeah,
it's not illegal. There's nothing wrong with that.
Yeah. That's terrible.
Yeah.
Anyway, that's the first thing I would do.
Okay, that's good.
Just try to overhaul the insurance company issue.
What kind of changes would be made?
That's hard because I think that there are many steps between how the insurance companies work right now and having a healthcare for all system. Like there are a few steps. So I think there would be a lot of legislature that would have to be passed in order to get to just a place that insurance companies just don't exist, and it's all like a single payer government provided tax dollar system. But I'm not well versed enough to like go into the details.
Into like super specifics, obviously.
Yeah.
Right.
But
what else would you change?
I think another thing I think of is I look at places like Native American like reservations, and they're completely neglected. They don't even have access to insurance a lot of times. So I think that's another place that I would just like be like, look, guys, we need to.
And they're ravaged by drug addiction, alcoholism, poverty, all the worst things.
Every disease you can imagine. I mean, it's horrendous.
Right.
And I think that's one thing that just needs to be. That should have been done in the 80s, 70s. You know, gosh, immediately after we colonized.
Yeah.
But like, it should have been done decades ago. That's one thing that I would especially go for as well. And other than that, maybe like legalizing marijuana for like medical marijuana, because there's so much good research for that. I don't know, those would probably be like my top 3. I don't know if I could accomplish all those within a year, like you said, if I was like within the first year, if I was elected. But I think those are kind of like my 3 tops.
All right. Well, Clay's running for Prime Minister of Health in 2020. Just kidding. It'd be funny if you actually do like end up in one of those positions, and you like look back and you're like, I remember when I was talking to Bogdan about this, and it was just like a hypothetical situation.
Right.
And like now I can actually do it.
Or like not.
Definitely let me know if that ever happens.
Okay. No, we'll be in touch forever.
Absolutely. Yeah, forever. Forever. Forever.
Colleagues for life.
For life. Or else death. This is what I would do as Prime Minister of Health. One, exactly the insurance issue. What I think could be done a lot in that field is have insurance more closely regulated by the government to basically only allow them to make certain profit, to make the act of looking for health claims illegal. And then on top of looking for like reasons not to give people health claims or a lot of these immoral practices, those I think should be legislated to not be legal or to have big fine penalties. Also, I think it would be crucial to have a healthcare policy that really took care of everyone in the country without any payment into it. I think, as you said, that healthcare is a fundamental human right. I take a very strong stance on that. It's a human right because if society is going to provide for anything, because society, we kind of join together as humans for the benefit of all. And what could be more beneficial than being healthy? I mean, that precludes everything. That precludes working, that precludes military service, being an effective entrepreneur, being a part of the economy. If you're not healthy, you can't do any of those things. And mental health is also part of that. That is being swept to the side. So definitely some kind of healthcare policy that applied to everyone. Canada has like a pretty good working system from what I've heard. Something along those lines. I mean, maybe we could take some of our, multiple $1 trillion military budget and just like, kick over maybe $1 trillion to healthcare and education.
That would be...
To have public hospitals that serve for free, where the doctors are paid well, that they could do whatever they wish in terms of benefiting the patient. They don't have to be artificially limited.
Yeah.
Another thing... definitely the legalization of psychedelics for use in medicine. I think there's an immense amount of research and anecdotal reports as well as experiential reports of things like MDMA and psilocybin, LSD being used for post-traumatic stress disorder, being used for severe depression. And some of these studies have found that if a person does them one time, they have lasting benefits for years later.
Right.
So it's not even just like a temporary fix. Like something pivotal happens to certain people and it can help them for a long time. So I think bringing back this shamanic knowledge back into our mainstream culture of using mind-expanding plants for healing purposes, not purely for recreation.
Sure.
I don't know how I feel about recreational usage of it, but I think that it definitely should be medicinally legal. I mean, it was before the whole... war on drugs that has been so unsuccessful. It's just increased drugs. And not the good ones. Not like we're talking like it increased heroin and cocaine usage, all these kind of very addictive, health-destroying drugs. Another thing that I would do is I would make sure that naturopathic medicine would be legal in all 50 states. Because right now, as it stands, naturopathic medicine is only licensed in 23 states. Oregon, Washington, Arizona being the biggest scope of practice, which is where I'm planning to stick around for that very reason. I think it's ridiculous with the healthcare shortages of primary care and kind of more rural setting healthcare. We're lacking it so badly, and everyone knows this. There's such a shortage of healthcare practitioners that to keep people bound down artificially is not right, and not allowing naturopathic doctors who really, we do get a very good clinical education. We learn all the physical exams, what the lab tests mean, on top of these natural therapies. So we kind of have our foot in both doors. So that makes us very uniquely accessible as like a kind of primary care provider.
Yeah.
Because we can, someone says, oh, I'm taking this and that supplement. We have something to tell them about it, and we have recommendations.
And
not just like, I don't know anything about that.
Right.
Just a typical response.
And just as much like clinical education as
Right.
any MD.
Yeah.
Maybe more than some.
Yeah.
Actually.
And we don't get paid very well as it is. So we're all here. It's all works of passion. So if that means anything.
Yeah.
Another thing that I would definitely change,
I think of one.
a naturopathic hospital. Not and what I mean by naturopathic hospital is a natural medicine hospital where like acupuncturists, body workers, energy workers, NDs, MDs, DOs, holistic medicine docs all together can work in like focusing on chronic illness.
Like
in like
integration.
a very
actually really
an
should be.
integrative hospital.
Yeah.
And that one would be free to the public.
Yeah. I like it.
And we take some of that funding from the military. Obviously, I'm not in any position to make any of those changes, but I think that those would make a big difference.
It's all
just one,
hypotheticals.
just
Yeah.
one to start off, just one, and then
I thought
What
of
was
another
your
one
example?
while you were talking.
Yeah.
I think the pharmaceutical industry. Like,
I missed regulation of the pharmaceutical industry. That's a big one.
yeah,
I can't believe I forgot that one.
yeah. Just, I mean, the fact that I think America, like the United States and New Zealand, I believe, are the only two countries in the world that are allowed to advertise for pharmaceuticals. I'm pretty sure it's New Zealand. I might be wrong, but like that would end. We don't need patients coming in like thinking that they need some drug.
That should definitely be illegal. There's no way that that's moral in any sense. Like the commercial that says like, oh, if you have these symptoms, do you have mild to moderate plaque psoriasis?
Right.
Ask your doctor about blah, blah.
Yeah.
It's like, what the hell is that?
Yeah, it shouldn't happen. And then
Doesn't
you
make
also,
any sense at all.
if you delve deeper into the pharmaceutical industry, there's just again a lot of corruption and a lot of political ties and like
a lot of money
lining
interests.
pockets and
Yes.
yeah, and it's
Lobbying
just-
groups.
Yeah, and it's if you've probably shadowed with a doctor who gets like those pharmaceutical reps come and like meet with
I actually
them.
haven't seen. Have
really?
Have you shadowed with a doctor
Yeah,
that gets them?
in my
coming?
undergrad internship, actually, I was with a doctor in South Carolina who he would just like the rep would just come in and buy the place lunch, like buy everyone on staff in the clinic lunch, and then the doctor was just like, all right, I'll start prescribing your pills, just like because he bought him lunch. He was like, all right, I'll put your.
That's such a good investment on that insurance.
But isn't it so messed up?
It's incredibly messed up.
And like that would end like the pharmaceutical.
But it
company
works. That's the
corruption.
problem, is that it actually works.
I know.
To get people to prescribe a medicine that maybe isn't indicated for the condition, just because they feel like I should. Or,
Exactly. Like he
or
was
even
giving-
worse, they get kickbacks.
He was giving metformin, which is a medication for
blood sugar,
diabetics, for like to people who weren't diabetic. And I was watching this, and I was like, I actually asked him about it, and he was just like, "There's some off-label uses that you can use it for."
What off-label use
I
was
have
he
no
using
idea.
it for?
He didn't say anything, and I've never looked it up since then. Like I guess I should.
I have heard of metformin having some research in cancer prevention and for metabolic disorders in general, not diabetes. I don't know if that's how he was using them.
I think he was just giving it just to
give
get kickbacks from the pharmaceutical
That
company.
no, that is like incredibly not only immoral, but that is actually illegal.
I know.
But it happens.
Anyway,
I mean,
that's-
people do illegal things all the time and don't get caught, right?
That's a tangent. But,
Yeah, pharmaceutical companies. Yeah, you know what I have noticed though? Naturopathic clinics and naturopathic schools being very heavily advertised to from supplement companies. This is the elephant in the room that we're not speaking about, because just because it's a natural supplement does not mean that it's ethical to you only serve this brand because they bought you lunch, or maybe because you get 20% profit if you sell blah, blah, a therapeutics company.
That's really true, because there are plenty of indies out there who just like supplement pushers. And that's like how they make their money.
Green allopathy, they call it.
Yeah.
Basically, allopathy in the sense of allopathic medicine, which is a term coined, I believe, by Hahnemann, the original homeopath, to refer to the conventional medical system, as opposed to holistic medicine. See, that term is upsetting somebody. So some baby's like crying in the background.
Sorry about that.
The beauties of recording in an apartment. Yeah. But yeah, so green allopathy, as in you just replace all of the practices and methods of conventional medicine. So like, oh, you have a headache, here's an anti-headache pill. Right. Oh, you have high blood pressure, here's an anti-high blood pressure pill. And just switching that pharmaceutical instead for a supplement.
Yeah.
That's like trying, and I think that is not helping anybody. Yeah. And I hear these stories of, somebody goes to their naturopath and come home with like 10 bags of supplements. Maybe they don't know what they're doing. Exactly. And they're just throwing things at people, or maybe more nefariously, they're making good profits on it. That part bothers me more than anything.
I think that's what it is more often than not, honestly.
Yeah, well, there's a good amount of profit that's derived, especially a lot of these companies. I have personally worked with some of these companies because I do sell herbal products. I'm working on this tea product, tea blends. But previously, I was working on putting together a tincture blend, getting it labeled, getting all the approval. There was a lot of red tape, a lot of regulations, insane insurance that I had to pay. So I put that on the back burner. Kentauros Therapeutics won't be making tinctures for retail within probably the next 8 to 9 months. But we will be giving away free tinctures if anyone wants any, because I got a bunch of tinctures and I can gift them. The FDA can't stop me from giving gifts.
You're right.
So I gave you one.
Thank you.
But anyway, the reason I bring it up is I was doing some online reselling of some of these like common naturopathically used brands. Okay. And there's an immense like kind of profit motive within the industry to like have a certain product and only sell that. And certain of those companies, they only will sell to licensed healthcare practitioners. So it produces this kind of strange, almost like what a pharmaceutical company is, but it's even more limited because only certain doctors can get it and they know about it. And my belief is that medicine, especially natural medicine, should be available widely to the people. And one of the big things I want to do with my tinctures is when I actually open my practice, I want to be able to control the quality of the things that I give as part of my treatment. So to like make my own like valerian and St. John's wort tincture from fresh herbs that I grew in my garden or my fields, hopefully. And to give that to a patient and know that this is really going to help them instead of, just giving them X brand or Y brand because X or Y brand sent me like a free trial and they give me some percentage.
And like because of that, you can assure that there's not like any additives or that like
exactly
there's like a full strength, not
Precisely.
Watered down, that sort of thing.
Precisely. So I think, it's interesting. I just heard a recent message from the FDA saying that it's going to crack down on supplement industry in the next coming years. They made like an announcement. Okay. So,
what does that even mean? Like,
it means probably that they're going to start persecuting people for making claims on supplement labels, for producing products without adequate regulation, without following good manufacturing practices. There's an immense amount of, if any of you guys are listening to this and you have a dream and you want to make herbal products, herbal tinctures or supplements, go on the FDA website and just look through at all these regulations because you're in for an amazing amount of red tape and an amazing amount of cost to get a product like that on the shelves legally. And as I was telling you before, there's a lot of people that are doing it illegally. They are not going through the FDA process of approval. They're not even properly labeling, and it's okay if they're just selling to their community. I personally have nothing against it, but what I will say to those people is be very careful because if the feds come for you, they will get you. I've already gotten in a little bit of trouble for reselling a certain brand of herbs. I read their policy and they had no policy against it, but apparently they had some hidden policy that I wasn't allowed to. No, for a certain brand of herbal products that I was like reselling to people because I personally believed in the strength of its products. Some of the best herbal tinctures I've ever used. But they actually sent me a cease and desist order to stop selling their product, or else they would take legal action against me. So in this world of politics and legality, make sure to CYA, cover your ass if you're going to be making any kind of natural supplement products, because there's a lot of freaking red tape in this industry that I'm just now learning.
What confuses me is that like every supplement or herbal, tincture, just whatever you get, has that little clause on it that says like the claims made on this label are not supported by the FDA, blah, blah, blah.
Sometimes it's not enough. If you make, one of their big rules is you can only make structure and function claims on supplemental products, meaning you can only say this is supportive to the liver. You can't say this treats hepatitis.
Right.
If you say it treats hepatitis, there's a lot of supplement products that do make claims like that, so specific claims.
A lot of things say like cardiovascular support, and they can't go.
They all say, because and it also has to be backed by research.
Yeah.
I think it's reasonable. I think the regulation is being a little bit misapplied by the FDA in certain cases, but they've been fairly lenient in allowing supplement companies to get away with it. But people do use them as medicine. So I think, honestly, this is a very controversial topic. Like, should, herbal medicine be regulated by the FDA as like a drug? And I think on one hand, there's a strong argument for, yes, protect the people. On the other hand, there's the strong argument for there's so much corruption in that field that, like, do you really want to bring more corruption into natural medicine? Yeah. And it's like, I would like those fields to be like regulated for quality and for people to be very honest about what they're making and not, have herbs from China that have tons of lead in it. I think that's like amazing to not have products like that and to force people to follow those guidelines or else they can't sell. Yeah. But then on the other hand, once, the lobbying starts and the pharmaceutical reps start saying like, oh, this kava product, like I don't like it because people are using it instead of this or that benzodiazepine or something like that.
Right, that's
and then they're like, ooh, they're in our market, and then they're like, oh, lobby against to make it illegal, like bring up this case of one person overdosing out of 1 million people who have used it, and it's liver toxic, so it has to be taken off the shelves. Right. There's an immense amount of this kind of stuff going on within these industries, so. It's very limiting for people to just get out there with an honest heart and just start doing their work, like to practice healing or to make herbs for people. It makes it incredibly difficult to do that. Yeah. And I think on the whole, the intention is to be beneficial, to protect public safety. But like, as you know, with all things written on paper, that's not often how it actually turns out.
It's true.
As legislature.
Yeah. Oh man, you bring up so many good points.
Yeah, it's certainly a topic I'm very passionate about. Yeah. I've been wanting to make medicine and share it with people for 5-6 years, even before I started this education in naturopathic medicine. And I will find my way.
You'll do it.
You would be amazed at these insurance companies for making supplement products. One of them quoted, now mind you, I made all these tinctures and they're all properly labeled, and I was trying to get them okayed by the FDA and by the Department of Agriculture and Food Administration, that kind of thing. And that was all fine, but I was required to have a certain kind of insurance for using a commercial kitchen to prepare these products, meaning a location like a nice clean facility to make these products in bulk. But this insurance was asking for over $200 a month for a product that I'm not even yet selling. Why? To protect the populace. From what? Like, it's interesting to like force someone to have insurance in the off case that they might get sued for their product, but like, why is that a requirement? It's kind of like the interesting thing with car insurance. It's like you're like forced to pay for something that might happen. It's like a requirement. And I understand the clause in car insurance is that basically protects like other people that you might harm, but like why would you ever be required to like for harm to come to you? Like that's your personal decision if you want to get insurance for that.
Yeah, and like what that makes me think is like sort of the same thing as homeopathy. Like they say it doesn't do anything. That's another discussion. Let's not get into that. But then,
But then it's dangerous.
Right.
This is a common argument.
But the same with herbs. Like they say that,
there's no proven effects.
Right.
But it's also dangerous to your health.
Right. So like
those ideas can coexist.
Exactly.
I think people need to decide whether they're dangerous, harmful poisons like certain websites that I won't even mention the name of on the internet because I don't want to get any coverage for them.
That's a good call.
Certain so-called scientifically based websites, let's say, that really are incredibly dogmatic in their approach to medicine and very dismissive of anything that smells even a little bit of natural therapy, which is kind of ironic because herbs have been used for the earliest case, I believe, was at least 10 to 20,000 years ago. They found herbs, like medicinal herbs, on a person's body. So herbs have been used at least for tens of thousands of years, medicinally, not just as foods, but like for specific purposes, like in a healing way. So herbal medicine is way older than this pharmaceutical stuff.
Big time.
I personally don't have anything like inherently against pharmaceuticals.
No,
I think they have their place.
Yeah, absolutely.
They have their place. They're a very strong weapon, but like, do you napalm every enemy country? Like, do you just nuke every country? Like, maybe you can approach the situation by like sanctions first, or maybe you can like, lower force intervention. I'm all about lower force intervention.
Totally.
And herbal medicine usually is that.
I have nothing against pharmaceuticals either. Like, I intend once I am licensed to get my DEA number so that I can, prescribe controlled substances. But just the fact that this is the Herbal Hour.
Yes.
I just want to focus on herbs.
I believe so. Yeah. I think that herbs are the healing of the people. Yeah. So any talk about global health has to be a talk about herbs, I think, too.
Yeah.
What are some herbs that you use on a regular basis?
Well, ashwagandha.
Ashwagandha.
Every day.
Every day. That HPA axis.
I just feel like your liver is so important. So I like to use, well, now I'm blanking on the name. What's the one that like the one, oh gosh.
Milk thistle?
Milk thistle, thank you. I just like to keep my liver healthy. So I use that one just probably every day, I guess. Maybe every other day.
That's a good general supportive.
Because your liver is just so important, for goodness sake.
Everything.
It does everything.
It does do everything.
And then, I don't really use a ton of herbs, like, consistently, unless I, like, need them for something. But those are the ones that I probably use most. I mean, I take probiotics a lot and stuff, too, but...
The ones I've been doing regularly are B-complex, higher quality fish oil, and at least, like, there's a certain dosage that research shows is actually effective. So I use that dose, which is more than most people probably take. It's quite a bit. It's quite expensive, actually. Not that bad for your health. I mean, pharmaceuticals are amazingly more expensive. So in comparison, they're pennies to the dollar. What else do I use regularly? Coffee. I consider that an herb. It has medicinal benefits. If you look in these traditional Western herbal books about coffee, it has particular uses.
That's interesting. I would never have thought of that as a herbal supplement.
It's a very strong medicinal herb. I mean, it's one of those like psychoactive herbs that you know when it's having an effect, like cannabis, for example. Like anyone who argues that herbs don't have an effect, like drink some coffee and smoke some cannabis and tell me that herbs have no effect. Because they're herbs. In the widest sense of the term. Like the term herbs refers to roots, refers to stems, plants, seeds, flowers, all those things.
True. Yeah.
Yeah.
Good
That's
point.
like a general term.
Yeah.
Yeah. Not just the plant part of it.
Cool.
What else do I use regularly? I also use milk thistle. I really like that one. I like NAC too. NAC has some good research behind it. N-acetylcysteine.
Yeah. Okay.
Yeah. I haven't used it in quite a while, but it's really good also for if you're going to have a few drinks or something, you're going out with friends, to take it like when you do that to actually protect your liver a little bit from the damage and minimize the hangover.
Okay.
Also, ginseng is good for that, I found. I found that to be effective, actually, in my experiences.
Interesting.
In my forays into the craft beer and cider world. I do love a good craft cider.
And hops. You got those bitters. You know,
Hops
for, like,
is a really
digestion.
powerful herb.
Yeah, and just like
For
you have a
sedating
good,
and
You
sleep.
have a good Northwest IPA, and then boom, you
Yeah,
have
you're just like
digestion,
sleepy and you
it's
feel
through the-
good.
Yeah,
You feel ready to party. And as far as herbs that I use regularly, I'm very big on using adaptogens.
yeah.
Ashwagandha, ginseng, Siberian ginseng, rhodiola, cordyceps. Sometimes I rotate through using them all the time.
Yeah.
And I found them to be very helpful if taken regularly.
I do like cordyceps, like in times like, you know, the transition from summer into fall into winter, like it just as like a protection against viruses and stuff like that.
Yeah, it's very useful. In Chinese medicine, it's used for supporting the kidney, meaning supporting like the adrenals and that energy system. Because in Chinese medicine, the kidney and adrenals are considered like one unit. It's just called kidneys.
Okay.
So it's like the energy, the vital force of the body is in a lot of ways stored in the kidneys.
Interesting.
The essence or the jing, they call it. But cordyceps builds that up. It restores that energy to this system. And I found that it's an interesting like herb. It grows out of the heads of caterpillars.
Isn't that strange?
Yes, it's
So
like
weird.
I believe it's not a spore. It's a fungi. Yeah, it's a fungi that grows in like high elevation mountains in like certain regions of the world out of caterpillars.
Just like it's like a parasitic thing that comes out of their
Yeah.
foreheads. Yeah.
It is so weird.
Yeah.
Yeah, fungi are weird in general.
Who figured that out?
Some genius. Some genius. That's for sure. So I use things like that. I also I use a lot of nervines in my life. Those are plants that are meant to support the nervous system. Like passion flower I'm always using. Chamomile I'm always using for all sorts of stuff like fevers, colds, like helping with sleep, just like a calm nightly drink instead of coffee, because you can't drink coffee too much at night unless you want to stay up all night.
Sure.
Which I sometimes do.
Yeah. Me
But
too.
chamomile's better for that. Peppermint, we have some peppermint tea here today that we were drinking with pine nuts
Delightful.
and honey. That was absolutely delicious. I love peppermint. What else? Lemon balm is really good. Makes a delicious tea. Very good, supportive to digestion. Very calming to like an anxious stomach,
That's
as
a
they
really
call
good
it.
one.
Ginger, I'm always chewing on. Garlic, I'm always chewing on. Yeah, those are probably the main ones. I use St. John's wort too because I released this product. Or I was about to release it to stores, but then I ran into a lot of issues, as I previously mentioned. But
Sure.
it had St. John's wort and valerian in it, both made from fresh plants. With the St. John's wort was from the wild, actually,
Oh, cool.
that I got from a farm. They collected it from the wild, not me, because I got like 6 pounds of it. I got a lot of it.
Dang.
Yeah, and I made a gigantic batch of that tincture. But it came out really good, and I started using it because I wanted to see like what are the effects of this. Because my personal belief is if you're not willing to take it yourself, like you better not be giving it to anyone, and selling it to someone is even worse than just
Completely
giving
agree.
it away.
Yeah.
So I wanted to experiment, and I did find it was very helpful for supporting my mood and focus, and more so than any other tincture. So unfortunately, I can't sell the product as of now because I don't have the licensing, but I will be giving them away for free, as I said. So just contact me at info@ktherbs.com to get free tinctures.
Ooh.
There's no ulterior motive. I have a lot of tinctures, and I have nothing to do with them since I can't sell them.
And the FDA can't do anything to
Exactly, because gifting is a different practice.
Right.
And I just want people to see the quality of this so that when it is for sale, they'll be like, ooh, I remember that. It was a really good tincture. And it will just be it'll be as good, if not better, when it actually releases.
And coming back to community health and public health, like that's a great way to educate people on like the potential effects of natural medicine.
Right. That's kind of my idea is like
Yeah.
to educate people on what is really best for them. I don't like want to like push a product, but I want to have a line of products that for any need and have the information out there that someone can decide for themselves which product that they should take
And if they
without
can-
giving medical advice to them outside like a one-on-one consultation practice.
Once licensed, yeah.
Once licensed, yeah. Once I'm licensed, I'll definitely be recommending herbs to
Yeah.
people.
But even just like for someone to have an idea that like have the experience themselves,
Right.
to understand that herbal medicine can actually have an impact.
Right, and I think that's it's a pivotal change. I think
Yeah.
a lot of things change once you realize that nature has some of the answers for us.
I mean, like I said, going back to what we were talking about, gosh, a long time ago, like Butterbur, I'd never experienced herbal medicine until like headaches stopped with butterbur.
All right,
like,
you heard that. You heard that here, guys, on the Herbal Hour. Get your herbal experience.
Not medical advice.
Not medical advice. Well, that's not specific enough to be medical advice.
True. Just want to say.
Yes, it is not. We are not approved by the FDA. We are not licensed physicians. Yeah, live your life.
Yeah.
As you wish to, not as people would tell you to, is what I would say generally. Yeah, well, thank you for being on the show. We got a solid amount of good stuff in here. Any last comments to our wonderful audience who's incredibly supportive of this podcast?
All I would say is if you're interested in my naturopathic philosophies on public health and global health, if you want to like get deeper into the ideas that I have, you can read the book by Tracy Kidder called Mountains Beyond Mountains about Dr. Paul Farmer and his work in Haiti. It's a fantastic insight into how global health and public health should be practiced the world over. So
Absolutely. How can we contact you or get in touch with the work that you're currently doing? Do you have like a social media handle?
Yeah, my I'm not really too active on it right now, but I have an Instagram. The handle is at leaders.in.naturopathy. Leaders in Naturopathy, Clayton Leaders.
Yeah, I thought that was really clever.
Yeah, I like it.
I'm following you, yes.
Yes, you are. I'm following you as well.
Nice, thank you.
Yeah, if you're interested, send me a message there. I check it semi-regularly. I'm trying to stay off of social media just for like, mental health purposes right now. But yeah, Leaders in Naturopathy on Instagram if you're interested in hearing more about my ideas on community health, public health, want more book recommendations.
Cool.
Whatever.
Yeah, well, I'm certainly following your account. Got some good stuff on there. I am also on Instagram, as you know, naturopathic.life. The reasoning for that name and why it's not personally named, which was an option that I had to put my name somewhere in there, is my goal with the account, number one, is to spread educational information, especially in terms of mental health and herbalism. Like really spread quality information, well-researched things, just to kind of educate the public, and also because I just love doing it, and it's always better to just share it because it always makes it more interesting.
Yeah, I think you do a good job too.
Thank you very much. I appreciate that. But the reason naturopathic.life is my aim with it is beyond simply myself. I really want to spread this beautiful medicine, naturopathic medicine. And that's actually one of the main goals of this podcast as well, is to get these holistic practitioners on here, natural practitioners, to talk about, what healing means to them and kind of sharing that nitty and gritty of the healing path with people and not just, trying to sell people things.
That's great. I love that.
Yeah. So naturopathic.life, you can find me there. My herbal company, we're going to be coming out with a line of herbal teas. They're going to be quite delicious. They're food-based products, not for medicinal usage. The company's called Kentauros Therapeutics. If you follow me on Instagram, you'll find me just spamming people with a logo. I find it to be of a nice color, so
It is lovely.
It's teal. It's my favorite color. But anyway, so that's it. I hope you guys enjoyed the show. And if you ever have any suggestions for a topic you'd like to see, or any speaker that would like to be on who can talk on holistic, integrative, or natural health, I would love to have them on. Just contact me once again at info@ktherbs.com. Thank you.
Awesome.
Bye, everyone. Thank you for being on the show, sir.
Thank you for having me.
Absolutely.